OK. Bonjour et merci de vous être joint à nous aujourd'hui. Permettez-moi d'abord d'exprimer mon profond chagrin à l'égard des événements qui se sont déroulés en fin de semaine en Nouvelle-Écosse. Une telle horreur et une telle haine seront toujours inexplicables. Mais pour que ceci ait lieu lorsque les Nouvelle-Écossais font des sacrifices pour protéger des vies humaines, c'est inimaginable. Aux gens de la Nouvelle-Écosse, tous les Canadiens partagent votre deuil. I'd like to start by expressing my profound shock and sorrow at the events in Nova Scotia over the weekend. This would be a tragedy at any time. But for this to happen now, as Nova Scotians are all making great personal sacrifices to preserve life, is a particular horror and a particular sorrow. To the people of Nova Scotia, all Canadians are with you in your grief. So today, we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Njoo, the Minister of Families, Children and Social Development, Ahmed Hussen, et le Président du Conseil du Trésor, Jean-Yves Duclos. Dr. Tam, please.
Hello everyone and bonjour à toutes et à tous. I will start as usual with the latest numbers on COVID-19 in Canada. There are now 37,374 confirmed cases, including 1,728 deaths. We have tested over 565,000 people to date, with around 6.5% of those testing positive. Though we are still a ways off and the path remains uncertain, I know that recovery and what's next is on everyone's mind right now. Canadians are patiently continuing to practice social distancing or physical distancing and staying at home. And this continues to be vitally important. Public health authorities are closely monitoring for continued and stable slowing of the epidemic, while carefully considering approaches to ease public health restrictions when and where this may be possible. But there are some hard truths that haven't changed. The first is that this will be a marathon and we are going to have to plan, pace ourselves, and not take any sharp turns. The second truth is that there are still a lot of unknowns and no 100% proven path before us. To get this right, there will be a need to learn as we go and to evaluate, adjust and right the course as we take cautious steps. These next steps may sound challenging, but there are things we've learned and things we now know that will keep us safe as we carefully navigate this path forward together. We know that the epidemiology in each jurisdiction is different, so the approaches won't all be the same. We know the timing, types and range of public health measures will need to be tailored to address the unique challenges and context of the disease in each province and territory. Likewise, additional measures may need to be adopted and maintained to protect vulnerable populations and high-risk settings within jurisdictions. Most importantly, we know that Canadians have demonstrated what has worked to slow the spread of this disease and what has kept our health system from being overwhelmed. There is no doubt that our sacrifices and everyday inconveniences over the past weeks have prevented an explosive outbreak in Canada, like the ones that have overwhelmed healthcare systems in places like Italy, Spain, and New York. What all this tells us is that we can't be too confident, we can't let our guard down, and we can't afford to have any weak points in our system. What we can do is ensure we all work together, stay the course, and work to strengthen supports that meet the needs of our most vulnerable members of society. If we ensure that basic needs are met for everyone, we protect the health of all Canadians. Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Njoo. Dr. Njoo, s'il vous plaît.
Merci. Bonjour. Commençons par les plus récents chiffres sur la COVID-19 au Canada. On dénombre maintenant 37 374 cas confirmés, dont 1 728 décès. On a testé plus de 565 000 personnes jusqu'à maintenant et environ 6,5% sont positifs. Bien que nous ne soyons pas encore sortis du bois et que la voie reste incertaine, on sait qu'en ce moment, tout le monde pense à la reprise et à ce qui va suivre. Les Canadiens continuent patiemment de pratiquer l'éloignement physique et de rester à la maison, deux mesures qui demeurent d'une importance capitale. Les autorités de santé publique suivent avec attention le ralentissement continu et stable de l'épidémie, tout en étudiant soigneusement les approches permettant d'assouplir les restrictions de santé publique au moment et aux endroits où cela sera possible. Mais il y a des dures vérités qui n'ont pas changé. La première vérité, il s'agit d'un marathon et nous allons devoir bien planifier, doser nos efforts et ne pas faire des virages serrés. La deuxième vérité, il demeure un grand nombre d'éléments inconnus. Il n'y a pas de chemin éprouvé à 100% devant nous. Pour faire les choses comme il faut, nous devrons apprendre en cours de route et faire le point, nous adapter et rectifier le tir alors que nous prenons des mesures prudentes pour tempérer les mesures de protection de la santé publique. Ces prochaines étapes peuvent sembler difficiles, mais il y a des choses que nous avons apprises et des choses que nous avons maintenant qui nous permettront de rester en sécurité tandis que nous avancerons sur cette voie ensemble. Nous savons que l'épidémiologie varie d'une administration à l'autre et que, par conséquent, les approches différeront. Nous savons que le moment, le type et l'éventail des mesures de santé publique devront être adaptés pour répondre aux défis et au contexte particulier de la maladie dans chaque province et territoire. De même, il faudrait peut-être adopter des mesures supplémentaires et les maintenir pour protéger les populations vulnérables et les milieux à risque élevé au sein des administrations. Et surtout, nous savons ce qui a permis de ralentir la propagation de cette maladie et ce qui a empêché la surcharge de notre système de santé, et les Canadiens l'ont démontré. À n'en pas douter, les sacrifices que nous avons faits et les désagréments quotidiens que nous avons subis au cours des dernières semaines ont permis de prévenir une épidémie explosive au Canada, comme celles qui ont surchargé les systèmes de santé en place en Italie, en Espagne et à New York. Tout cela nous indique qu'il ne faut pas être trop sûr de nous, qu'il ne faut pas baisser la garde et que nous ne pouvons pas nous permettre d'avoir des faiblesses dans notre système. Ce que nous pouvons faire est de travailler tous ensemble, de maintenir le cap et de nous employer à renforcer les services de soutien offerts aux membres les plus vulnérables de la société. Si nous veillons à répondre aux besoins fondamentaux de chacun, nous protégeons la santé de tous les Canadiens. Merci.
Merci, Dr. Njoo. And now we will hear from our Minister of Families, Children and Social Development, Ahmed Hussen. Ahmed, please.
Thank you very much. Bonjour tout le monde. Canadians know that when they experience personal difficulties as a result of natural disasters, be it wildfires in British Columbia or a tornado right here in Ottawa, or something closer to home like losing a job, that every time countless charities across the country are there to help them. They're there to step up and help them in every way that they can. Canadian charities and non-profits are there to help us in our time of need. Les organismes de bienfaisance sont toujours là pour aider les Canadiens en cas de besoin. But the COVID-19 pandemic is bringing real challenges to these really important organizations. At the very time that countless Canadians across the country are relying on these organizations, some for the very first time, Canadian charities and nonprofits are having to deal with extra costs, procuring and obtaining personal protective equipment, increased costs as a result of staffing shortages, other challenges in their communities as a result of getting materials needed to do their work. And to make matters worse, they're also experiencing a dramatic drop in the amount of donations that they usually receive. So at a time when Canadian charities and nonprofit organizations are being asked to do more by Canadians who need their services, they're seeing a drop in donations and a drop in the number of volunteers that they can rely on. And this has a direct impact on vulnerable Canadians, like older Canadians, people with disabilities, racialized Canadians, including Black Canadians, are being significantly impacted by these developments. So our message to Canada's community organizations and charities is that we will support you. At the time that more and more Canadians are calling on you to provide more services for them, we will support you so that you can meet that request, so that you can answer that call. And as the Prime Minister said, we have your back. That is why the Prime Minister announced that we are providing $350 million to support in an emergency fashion to help charities and non-profit organizations adapt their frontline services to vulnerable Canadians during COVID-19. C'est pourquoi le Premier ministre a annoncé une aide allant jusqu'à 350 millions de dollars en soutien d'urgence pour les organismes de bienfaisance et à but non lucratif qui aident les Canadiens durant la COVID-19. We are partnering with large national-level organizations like the United Way Centraide Canada, the Canadian Red Cross, and Community Foundations of Canada to ensure charities and non-profit organizations from across the country are able to provide much-needed support to vulnerable Canadians. And they will be able to do this by flowing the money quickly to everyone, including local community-based organizations that have the relationships, that know the people in their communities who need these services immediately. This money will help groups like those in Eastern Ontario that are working to provide meals to those who cannot leave their homes, who are not able to do that. It could also help organizations such as the Atlantic Compassion Fund or the Vancouver Foundation, which is providing much-needed support to women who are fleeing domestic violence. We know that these are very difficult times for Canadians, but the Government of Canada is working to ensure that those organizations that Canadians are relying on have the resources that they need so that they can continue to help Canadians now and into their future. I want to thank all the organizations, charities, and community leaders, including faith leaders, that have reached out to me and my colleagues over the last number of weeks for their hard work on this and their feedback and their guidance on how to get this right. Lastly, I want to thank the volunteers and the frontline workers, the service providers, who are tirelessly working day and night to provide much-needed critical services to our most vulnerable in their homes and in their communities. Thank you so much for everything that you do. Nous sommes là pour vous. Merci beaucoup.
Merci, Ahmed. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Chrystia. Bonjour tout le monde. Hello, everyone, and thank you for joining us here today. The spread of COVID-19 has brought about unprecedented consequences and circumstances for Canadian businesses and workers. Our government is committed to helping Canadian employers support their employees during these very tough times. That is why the Prime Minister, again this morning, has reiterated and announced the introduction of the Canada Emergency Wage Subsidy in order to help businesses support their employees in these very difficult times. Le gouvernement est déterminé à aider les entreprises canadiennes et leurs employés en ces temps difficiles. Et c'est pourquoi le Premier ministre a annoncé ce matin la mise en place de la subvention salariale d'urgence du Canada afin d'aider les entreprises à verser des salaires à leurs employés dans les circonstances difficiles que nous vivons présentement. The Canada Emergency Wage Subsidy is designed to help employers keep and rehire workers amidst the challenges posed by the COVID-19 epidemic. Having the ability to retain staff and rehire people will put employers in the best possible position to resume normal circumstances once circumstances do allow it. The health and wellness of Canadians is also that much better when people have the ability to pay their bills, their rent, and buy food for their families. It is the government's intent to keep as many Canadians working as possible, and the implementation of the Canada Emergency Wage Subsidy is one of the measures in place to support this goal. La subvention salariale d'urgence du Canada fournit une subvention de 75% des salaires pouvant s'élever jusqu'à 847 $ par travailleur par semaine pour jusqu'à 12 semaines en tout. La subvention est rétroactive au 15 mars et les demandes vont pouvoir être déposées à partir de lundi prochain, soit le 27 avril. L'Agence de revenus du Canada administrera la subvention salariale d'urgence du Canada au nom du gouvernement du Canada. L'Agence verse des paiements de prestations à des millions de Canadiens et de propriétaires d'entreprises chaque mois et fournir un accès rapide, efficace et facile aux entreprises canadiennes et aux contribuables est au cœur du mandat de l'Agence. Today, the Canada Revenue Agency is launching a Canada Emergency Wage Subsidy webpage. The page includes a calculator that will help employers to determine quickly the subsidy amount they can expect to claim based on the information that they enter into the calculator. The government is grateful for the input we have received from many stakeholders during our consultations in the last few weeks. These consultations have led to the efficient and quick launch of the website today. J'ai le plaisir d'informer les Canadiens que l'Agence du revenu du Canada lance aujourd'hui un site web et un calculateur en ligne qui va permettre aux entreprises de prévoir et de se préparer au dépôt de leur demande de subvention salariale d'urgence pour aider leurs travailleurs. Nous remercions les représentants des entreprises et des travailleurs pour leur appui considérable à la préparation de ce site web. Businesses will be able to apply for the Canada Emergency Wage Subsidy as of April 27th. It is expected that 90% of the applications will have been processed by the 5th of May, with direct deposits and checks made and sent soon after. Until then, businesses are invited to update their business account on the Canada Revenue Agency's website. A technical debriefing session will also be offered this afternoon to the media. À partir du lundi 27 avril, les entreprises pourront déposer leur demande de subvention salariale d'urgence. On s'attend à ce que 90% des demandes soient traitées en date du 5 mai suivant et que les remboursements de salaire suivent rapidement par la suite. D'ici là, les entreprises devraient s'assurer de mettre à jour leur compte d'entreprise sur le site de l'Agence de revenus du Canada. Une séance technique sera aussi offerte cet après-midi aux médias. En terminant, le gouvernement est déterminé à continuer de soutenir les travailleurs et les entreprises qui vivent des difficultés importantes en raison de la présente pandémie. Merci, Chrystia.
Merci, Jean-Yves, et on est prêt à répondre à vos questions. Carl.
Thank you, Deputy Prime Minister. As usual, we'll start with 3 questions on the phone avant de prendre les questions dans la salle. 1 question, 1 follow-up. Operator.
Thank you. Please press star 1 at this time if you have a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question. Notre première question vient de Louis-Samuel Perron de la presse. À vous la parole. Please go ahead.
De l'Agence de revenus du Canada. Une séance technique sera aussi offerte cet après-midi aux médias.
Monsieur Perron, votre ligne est ouverte, vous pouvez procéder.
Le gouvernement est déterminé à continuer de soutenir les travailleurs et les entreprises qui vivent...
Operator, I think we'll take the next question.
Certainly. Our next question is from Jean-Yves from CBC. Please go ahead.
Hi, my question is for Dr. Tam. Dr. Tam, your counterpart in the U.S., Dr. Fauci, talked last week about a road back for professional sports games played without any fans in the stands. I'm just wondering, do you think a similar thing could happen in Canada? And can I just get your thoughts on potential return of professional sports in Canada?
So right now, together with all the chief medical officers of health, we are looking at the next phase, if you like. Again, stressing extreme caution in how we have to keep going right now with the measures that we have. We know that population immunity is not going to be high, so that we have to move extremely carefully. I think we will be looking at all different kinds of community settings or activities and providing I think that it has to be a sort of risk-based approach, a risk assessment, and that will include this area. But I think as some of these innovative thinking is coming together, these are some of the ideas. But again, that 2-meter distance and ensuring that we don't spread the illness is extremely important, whichever solution people are going to think of. So absolutely, I think every sector should begin some thinking about how innovative they can be in maintaining that social distance, because we don't have other specific measures to treat or this virus or the vaccine. So any the new normal must take into account of stopping the spread of the virus like we have now. So, I think it's the other perspective I have is just engaging the communities and the sectors that are looking at their own specific situations, because public health can't possibly assess every setting. We can provide guidance as to how you maintain safety and the health and of the population and the clients or the people that they serve.
Jamie, follow up.
Just to be more specific, would you be supportive of games being played in Canada before empty stadiums? Would that be safe in your estimation?
Well, I think together with the other chief medical officers, we have to look at what plans there are with the people who are actually going to be potentially in contact with each other. So I think for sure, crowded conditions, mass gatherings is not in any of our near future. I think that is sort of pretty evident. As to whether certain activity can be done safely, that needs further assessment.
Thank you, Doctor. Operator, next question, please.
Our next question, notre prochaine question d'Hélène Buzetti, Le Devoir. À vous la parole.
Question is for you. Last Thursday, your predictions were that we would have between 1,200 and 1,600 deaths by today, and in fact we're at 1,700. That's the second time your short-term predictions are off. So my question is, should we still trust them? And more specifically, when you're looking at Quebec, where there are now 54% of all Canadian deaths, are you concerned about the situation? And is there something Quebec is doing wrong that would explain the situation?
So, as we've always said, the modeling is for planning purposes. They're not there to accurately tell you what the numbers are every single day. And every single day that we relook at those projections, they will change depending on the actual cases being reported. So whatever I said several days ago, the 24 hours following that, those projections will already have changed. So I think that's some of the difficulties if you're trying to communicate where we're at. But it is within a similar range of severity. And I think it is a reflection of the population that's most impacted right now in many areas of the country. And those are the seniors and those who are in long-term care homes. So absolutely, this is a reflection, I think, of the actual epidemiology of this illness in Canada. So I think every jurisdiction must do their utmost to enhance infection prevention control in all of those settings. So that's absolutely critical. And I think any model is going to tell you that, that is, what we're doing right now is going to change the trajectory. Those models are very sensitive to what we do today in terms of projecting into the short or further down the road. So, I think everything must be done to change the course, and it is up to everyone who's responding to help do that.
Well, as a follow-up, you haven't really specifically addressed the question of Quebec now that the province, which represents roughly 23% of the population, has 54% of all deaths. How do you explain that? And or should we start to think that maybe Quebec is not doing something right?
Well, I think we do know that many of the cases are linked to long-term care facilities. So I think my answer stays the same. It's not the only jurisdiction. In fact, many provinces have outbreaks related to long-term care facilities, but it is a major challenge in the context of Quebec. And I know that from a public health perspective, they are, escalating and trying to manage that situation.
Thank you, Dr. Operator. One last question on the phone before we turn to the room.
Thank you. Notre prochaine question est de Mélanie Marquis de la Presse. À vous la parole, please go ahead.
Merci beaucoup. Ma première question serait pour Monsieur Duclos. Monsieur Duclos, comment allez-vous vous assurer de faire le calcul quand même assez complexe des subventions salariales aussi rapidement pour potentiellement des millions d'entreprises au pays?
Bien, merci. Et vous avez tout à fait raison de dire que c'est un calcul qui est non seulement complexe, mais qui est urgent parce que les conditions de travail des travailleurs au Canada et au Québec en particulier sont très difficiles et on veut que cette subvention d'urgence amène rapidement les entreprises à engager et à réengager leurs travailleurs. Alors aujourd'hui, ce qu'on annonce, c'est qu'il y a un calculateur et des informations très substantielles qui sont disponibles sur le site de l'Agence du revenu du Canada pour que les entreprises puissent préparer leur demande finale et complète dès le 27 avril prochain. Alors, j'ai moi-même circulé à travers ce site web. Il est bien fait. Il y a beaucoup d'informations qui vont permettre aux entreprises de commencer à planifier leurs demandes, mais aussi à planifier leurs décisions d'embauche et de réembauche si ces décisions n'ont pas déjà été prises. Et on a confiance que l'Agence du revenu du Canada, avec les compétences extraordinaires des travailleurs qui y travaillent, l'Agence va être capable de livrer rapidement, à partir du 5 mai, donc annoncer les réponses et livrer les remboursements qui vont avoir été demandés.
Suivi.
Oui, merci. Ma question de suivi serait pour either Dr. Tam or Dr. Njoo. It's about the mask wearing policy or instructions. Quebec is working on a scenario right now, or on a new scenario for as far as masks go. I wonder if you're involved in these discussions and if you would make masks mandatory as they have been declared mandatory for air travel.
So I think I work with all the chief medical officers of health, so any recommendations goes towards that table, the special advisory committee, and it forms a guidance or baseline upon which different jurisdictions will make certain recommendations. For sure, I think having facial covering on our medical mask, if you're not in the healthcare setting, because we've always said, you need to preserve actual personal protective equipment for that circumstance. And masks do not replace all the other important measures that we do know work in terms of physical distancing, hand washing, hygienic measures. But it does form another layer of protection, which is, can be applied when you can't maintain that 2-meter distance. So that is, depending on what setting you're talking about, that is definitely something that can be considered. In the transportation, like on a plane, as one can imagine, that social distancing would be quite challenging, which is why that policy was added. As well, in our Quarantine Act, when we now have mandatory orders for both symptomatic and asymptomatic travelers for isolation or quarantining, quarantine for the 14 days, we also now provide a requirement for the wearing of a mask as people are transferring to their place of quarantine as well.
Thank you, Dr.
C'est Dr. Njoo. Peut-être je peux répéter la même chose en français. Dr. Tam et moi, on travaille étroitement avec nos homologues des provinces et territoires, incluant le Québec, avec notre comité consultatif spécial. On a vraiment discuté l'enjeu des masques non médicaux. J'ai aussi entendu ce que Dr. Hajdu a dit, je pense que c'était hier au Québec, et c'est aligné avec ce que Dr. Tam et moi on a déjà dit, que les masques non médicaux, peut-être pour protéger les autres, c'est quelque chose et on peut considérer, mais c'est pas un remplacement pour les mesures de santé publique déjà prouvées, comme l'éloignement physique, garder les 2 mètres, aussi se laver les mains, toutes les bonnes pratiques d'hygiène personnelle. Mais si on est dans un contexte que peut-être dans un transport en commun ou peut-être à l'épicerie, aussi pas possible de garder la distance de 2 mètres, si oui, c'est quelque chose à considérer. Et absolument aussi, il faut consacrer les masques médicaux pour les travailleurs de soins de santé sur le terrain en première ligne pour eux. Merci.
Merci, docteur. On va prendre les questions dans la salle, starting with Kevin from CTV.
This question could be mostly for the health minister, but perhaps Minister Freeland or Dr. Tam could also weigh in. So Kristen Beaton was one of the victims in the Nova Scotia shooting. She was also a frontline healthcare worker providing continuing care. Her husband told CTV News this morning that before this tragedy struck their family, they were already living under quite a great deal of stress. She was coming home and very terrified that she would pass on something to her children and her family because she was reusing protective equipment because there was a shortage in Nova Scotia. There was not enough for her and her colleagues. What do you say to the Beaton family and to other frontline healthcare workers when you hear stories like that, that there's not enough PPE to go around?
I'll start. And first of all, obviously, my heart is with Mr. Beaton in this terrible time of loss. I can't even imagine how hard it is and how difficult it is for him as he loses his wife and his soon-to-be child, I understand. And so on the issue of personal protective equipment, I will tell you that the federal government has been supporting provinces and territories to procure equipment, as you know, over the course of the outbreak and pandemic. We've managed to work very well with provinces and territories to fulfill their requests for support around personal protective equipment and other medical devices. It, as you have heard us say many times, has been a very challenging thing to do in the time of a global pandemic where supply chains are disrupted, where all countries are scrambling to try and boost up their capacity to produce PPE, including Canada. I will also say that I know that the provinces have been working very diligently to try and ensure that they're distributing PPE to the hospitals and care facilities. And I will say to Mr. Beaton that we all have to redouble our efforts so that there aren't stories of people that have to reuse masks. There are a number of creative ideas that have come forward from partners around, for example, the sterilization of masks, and we have now approved companies here in Canada that can do that, and there will undoubtedly be even more domestic production and capacity. But I think what it reminds all of us who are the ones trying to facilitate this national response is that we can leave no stone unturned, not at the local level, not at the provincial level, and certainly not at the federal level.
We can do a follow. Is that okay? All right. Is there anything more that can be done in terms of providing greater supplies of protective equipment? Also, I'm thinking about the federal government's potential role in testing, as some provinces, namely Ontario, are having a difficult time meeting up some of the goals they put out for testing and the importance that will come into play. So for PPE and testing, the federal role.
Well, we all have our eye on testing. It will definitely be part of the strategy that Dr. Tam is working with with her colleagues on the next steps in terms of as we emerge from this first wave of illness. Certainly at the federal level, we have tools that we can support the provinces and territories with, and we have been, and namely that's financial resources, that's product, and in this case in testing, it's approval of new testing capacities, for example, and or the equipment that goes along to support that testing. For example, reagent and the chemicals that produce reagent and the domestic ability to manufacture that reagent. and also guidance, how we use those tests in the most efficient way. And in fact, Dr. Tam works on that guidance with her counterparts, and it is constantly under review and being renewed as we both ramp up our capacity and understand better how to really get a good sense of what's happening in the country. I will say again, and it's a similar answer, we can all do better. We can all do more. I know that various provinces and territories have struggled with their capacity to test, and we are always there to support them, whether it's people, whether it's financial resources or equipment. We'll continue to work with the provinces and territories to understand what the particular barriers are in their case in terms of their limitations, and work to provide solutions to alleviate those limitations. Thanks.
Thank you, Minister. Julie?
Julie Van Dusen, CBC. I think it's for Dr. Tam. The U.S. estimates it will need about 300,000 people to do contact tracing, especially as it wants to reopen its economy and trace infections. How many will Canada need, and how is that training going so far?
So contact tracing is pretty much a everyday job for local and provincial public health authorities as well. So they are thinking this through. This is one area that really stress that we need to make sure there's enough capacity to do contact tracing. So, and we have offered our support. There's a number of volunteers and people who signed up to our portal in terms of people who can help. So provinces can draw on those rosters in terms of support for contact tracing. But the numbers are up to individual, even health authorities at the local level to figure out how much they need and to let us know if they need anything else. But I know that the whole public health system knows that contact tracing is going to be very important as we look towards that next phase.
I'll just add that it is extremely important that we understand the investments that we make in public health, both from a prevention perspective and a public health perspective, are critical to the next steps of whether you call it reopening the economy or moving forward in terms of recovering from the pandemic, that if we don't have local public health capacity, we will be significantly hindered in our abilities. And so we regularly have that conversation with provinces and territories at the health minister's conversation table. It is very important that we continue to redouble our efforts to support public health, and I think Dr. Tam is completely accurate when she says that public health is local, that this is something that happens at the municipal level, that is often funded provincially, but facilitated at the local level in partnership with municipalities.
And in a sign that contact tracing is something we're all focused on, I'll just add one thing, which is I had a good conversation with Premier Ford this morning. We talked about the significant progress that Ontario has made in testing and the big difference that that is making. And we also talked about contact tracing and how essential, as your question underscores, Julie, how essential contact tracing is today and also going forward. And we talked about being very good at communicating with each other and being sure that if there is anything that Ontario needs in terms of support on contact tracing, we will all be ready to provide it.
Okay, great. The next question is about the meatpacking plants. So I'm not sure if it's for Patty Hajdu or I'm not sure. So we know the union sounded the alarm a week ago when there were 38 cases at the Cargill plant. Now there's 484. So somebody dropped the ball. Who's going to make sure these places are safe to work in? And who can tell us if the meat packed in these COVID-filled plants is safe to eat?
Well, thanks, Julie. I'll start with an overview, and then I'm going to turn to Dr. Tam because she's been actively involved on the meat packing plant outbreak and other outbreaks and other food facilities. First of all, it's critically important that every sector realize, and sort of back to earlier comments, that every sector realize that they are going to have to be extremely thoughtful about the measures that they take and put into place to protect their employees, because it's not just a matter of a nice thing to do, it's an actual essential component to ensuring that their industry remains strong and able to continue to provide the services or the goods that they provide. We obviously obviously support industry as well as public sectors and in responses. And Public Health Agency of Canada is and has been working on guidance for a variety of different essential workers. And we're very concerned about outbreaks in the food supply chain. Obviously, this has a critical importance, not just to the industry, but to the many Canadians along that chain, but also the Canadians that ultimately end up being consumers of the products that farmers are producing. So we have our eye on this very closely right now, and I will turn to Dr. Tam to talk about the details about that particular plant.
I think the outbreak investigation is very much in the jurisdiction of the province of Alberta, and I know that my counterpart is working very hard with the local health authorities. So I think that we're always there to support if they need any extra, support, in whether it's epidemiologists or others, but they are managing the investigation of this outbreak. And what I will point out is that it's not just the workplace, but also, of course, the social environment of the workers, making sure that they have the support that they need to keep themselves safe and reduce transmission in the home settings, as well as the work settings. I think the details of exactly what happened in terms of the transmission, I think the Alberta Chief Medical Officer will have a much greater detail, but I know that the risk is not just in the plant itself, but it's more sort of perhaps in the families and the households in those contexts. So I think that's sort of really important to clarify. But I think all essential workplaces must have the necessary protocols, administrative protocols, physical and environmental adjustments, and as needed, whether it may be masks or personal protective equipment or others that the workers might need, should they not be able to physical distance or observe some of the other public health measures. So I think those are some of the key aspects. Of course, we provide the guidance, but I think the implementation is never as easy as one sort of have on a piece of paper. So it's the detail of how that would work in those settings. The other thing is the realization that, again, I think testing does play a role, so that if there are cases under certain circumstances, then a much more rapid and detailed testing protocols need to be put in place. So practicing good food safety measures is the key, or everything that we communicate to Canadians every day about hand washing, safe kitchen preparations, cooking any kind of meat appropriately, then it's perfectly safe.
Peut-être je peux répéter quelques mots en français. Ce que notre ministre a dit, que c'est vraiment une priorité pour le gouvernement fédéral, la sécurité de notre système de nourriture à travers le Canada. On continue à travailler étroitement avec nos homologues des provinces et territoires, et aussi même entre les ministères ici au sein du gouvernement fédéral. C'est sûr, il faut avoir comme des protocoles, des mesures en place à l'échelle locale. Comme Dr. Tam a dit, nous autres, si on parle de le domaine de santé publique, on est toujours là pour donner l'appui aux provinces et territoires avec les lignes directrices, avec aussi augmenter leur capacité pour tester les employés. C'est sûr, pour les employés, c'est important d'avoir les protocoles, aussi à la disponibilité de l'équipement de protection individuelle pour tous les travailleurs essentiels, et aussi avoir une moyenne aussi d'assurer que c'est pas seulement dans le milieu de travail, mais aussi leurs accommodations, les logements. Parce qu'on sait pour beaucoup des travailleurs qui travaillent dans des services essentiels pour la nourriture, ils sont aussi des travailleurs peut-être étrangers et temporaires. Il faut aussi assurer avec les employeurs qu'il y a c'est quoi en français, et on a fait des moyens en place pour assurer pour leur quarantaine quand ils rentrent au Canada, c'est efficace. On suit aussi comment on peut assurer qu'ils gardent la distanciation physique dans les logements et aussi au travail. Des fois, c'est peut-être un défi, mais c'est quelque chose. On continue de travailler aussi avec nos homologues aux provinces et territoires pour assurer ça. Merci.
Thank you, Dr. Kelsey.
Thank you, Kelsey Johnson with Reuters. Following up on Julie's questions about the meat plants, Minister Hajdu, you are also the minister responsible for CFIA. So I'm wondering, given we've now got several outbreaks in several meat plants, many of which are federally regulated, if CFIA is looking at establishing some type of national protocol for these meat plants so that the decision on whether to shut the plant or not is not left to only being a commercial decision and may be made or determined by Ottawa or somebody else.
Well, as you know, CFIA already has that ability to shut the plant if, in fact, there is, reasons to be concerned about food safety or other practices that might lead to health risk for Canadians. I share the responsibility of CFIA with my counterpart, Minister Bibeau, and we had a conversation last night, actually, about the Cargill meat plant and what we can do industry-wide to better support the sector from a regulatory perspective or from a structural perspective, really, to help support the sector. This is a really, really important conversation, actually, not just obviously for the illness of the workers, which is difficult enough, and in fact, one worker has already died. This is a significant outbreak, but also for the sustainability of the food chain. And so we continue to have those conversations. I know that Minister Bibeau has her eye on what practical supports need to be in place for the industry, and we're going to continue that work in a very quick fashion to make sure that we can understand how best to support not just the plants, but also the farmers behind the plants who are in a very difficult situation now as the capacity to actually process beef is reduced significantly.
And then just to follow up again on the meat situation, earlier this morning, the Prime Minister mentioned that the industry has said that their priority will be the domestic supply and that we export a lot of meat. So I'm wondering, is there any discussion about restricting meat exports to prioritize the domestic sector? But also wondering if there's any conversations about dealing with the capacity shortage about sending cows or cattle to be slaughtered in the U.S. or elsewhere.
So I'm veering into Minister Bibeau's file a bit, and I will defer the details of the answer to Minister Bibeau and encourage you to follow up with her office. But exactly those kinds of considerations are on her mind. Maybe the Deputy Minister has more information, but I think the Prime Minister is obviously the Prime Minister is very focused on the food security for Canadians, and we will ensure that Canadians have enough food to eat. The steps to do that are still under discussion, but that is of the utmost priority for all of us. Do you have anything?
Yeah, no, absolutely. And just to add that Canada is in a really lucky position because we are a major global food producer. That is a very good thing to be at all times, and maybe especially at this time. The food processing industry has been very proactive about being really clear that the priority will be to support and supply Canadian consumers. That is great. And as Minister Hajdu has just said, Canadians should take a lot of reassurance from that. In terms of the whole North American supply chain, as I'm sure you know, Kelsey, U.S. food processing plants have also been facing a very similar situation. So this is a shared reality.
Thank you, Deputy Prime Minister. We'll take one question on the phone and then one last question in the room. Operator.
Thank you. Notre prochaine question est de Micheline Laflamme de Radio-Canada. À vous la parole. Please go ahead.
Oui, bonjour. Est-ce que le gouvernement va réviser le nombre d'immigrants permanents qu'il va recevoir cette année, ou du moins, est-ce que la crise actuelle va avoir un impact sur le nombre qui va être accepté ou qui va arriver, ou si aussi on risque peut-être d'augmenter le nombre de résidents permanents qui ont déjà fait des demandes, qui se trouvent déjà en territoire canadien.
Thank you for the question. As you know, we always have immigration levels planning every year in consultations with Canadians and the settlement sector. That's exactly it. It's a target. Who lands at the end of the year depends on the choices that people make in terms of actually exercising their option after being selected to arrive in Canada. So that those numbers fluctuate. My understanding is that in the context of COVID-19, that number will certainly be impacted. And my sense is that there will be, of course, a fluctuation in that number. But as I said, the plan remains the same. It's people's choices in terms of when they get that selection, whether they choose to exercise that selection to land in Canada, and what year they do that. That impacts the number of people who actually land in Canada as permanent residents.
Micheline, non suivi?
Yes, well, I understand that, but do you have, like, I understand that, it's an open, you have targets and it depends on the number of people you have, but as you look at the number that you can receive now, and considering that, often people cannot get their medical test done in their country of origin and there's less people in the embassy, do you have an idea of maybe the impact that it will have on the number?
My sense is it will have an impact on the number. How severe that impact will be will certainly depend on a number of variables that are difficult to predict at this moment. But certainly it will have an impact on the number of people who will be able to land in Canada after being selected through our various permanent residency immigration streams.
Thank you, Minister. Mike?
Mr. Duclos, could you repeat a little bit of what you were saying about the new wage subsidy in English?
Yes, with pleasure. So this morning the Prime Minister announced that starting on today, so at this very time, the Canada Revenue Agency is launching a website which is comprising of all sorts of important information that businesses can therefore learn from, and also a calculator that is going to help businesses prepare to submit their application starting April the 27th. So this is going to be very welcome by businesses across Canada and certainly by workers who are very much interested in their ability to make ends meet, obviously, but know that they can do this through the wage subsidies that we are putting into place. And on May the 5th, so just a few days after the application is being made by businesses on April the 27th, so on May the 5th, we expect 90% of those applications will have been processed, and therefore that payments will start to be sent to businesses so that they can hire and rehire their workers.
Okay, thank you, sir. And I understand this is a process that is happening in weeks instead of months or years usually, but this wage subsidy took a lot longer to pull off than the CERB. So could you give us some insights behind the scenes? What was the difficulties or changes or factors that might have caused that?
Well, this is the most important economic program that the federal government ever designed and certainly ever implemented. Just about 2 weeks ago, less than that, we voted in the House of Commons to have the authority to put that into place, and the Canada Revenue Agency workers have since then worked very hard to implement that. And the fact that we are able to launch a website today that is going to provide all the information that businesses need to prepare and then to submit their application is very good news for workers and businesses. And the fact that we can rely on the Canada Revenue Agency, a strong agency with a strong technology and most importantly, strong workers to put that wage subsidies into place is great news. The Canada Revenue Agency every month delivers Canada Child Benefit payments to 3.5 million families. It has handled over 8.4 million applications of the Canada Emergency Response Benefits in the last few weeks. So it's a very strong organization, and strength and confidence are key in the current circumstances.
Thank you, sir.
Thank you, Minister. Ceci met fin à la conférence de presse. Merci.